You know about diabetes, but do you know the major effects it has on one's body? One of them being diabetic retinopathy. Diabetic retinopathy is an eye-related complication seen in people with diabetes and one of the major effects of uncontrolled blood sugar levels. The effect is so severe that if left untreated, the patient might lose their vision completely. Diabetic retinopathy is the leading cause of preventable blindness in adults aged 20 to 74 years. Globally, there has been a steep increase in the number of diabetic patients. From 415 million reported till 2015, it is predicted to rise up to 642 million in 2040. Well, these are just numbers. We still don't know how many of them actually have diabetic retinopathy because of lack of awareness and education about the same. Diabetic retinopathy, or DR, is emerging as one of the leading causes of visual impairment in low and middle-income countries. Two-thirds of the Indian population resides in rural areas, where access to modern medicine is limited mostly to the public health system.
Diabetic retinopathy is a small blood vessel disease where the small vessels of the eye, they become leaky, they become hard, rigid and become blocked, and because they get blocked, the cells of the retina no longer get their nutrition, and because they don't get their nutrition, they begin to die, and when they begin to die, they start sending messages, do something for me. And then the eye starts creating fragile vessels on the surface of the retina. And these fragile blood vessels have a tendency to bleed, and because of bleed, there is a sudden vision loss. At the same time, the vessels are also rigid and leaky, and because they are leaky, so fluid starts collecting in what is the central part of the retina, what we call the macula. So two main things happen. You have diabetic maculopathy, which causes fluid collect within the macula, causes vision loss, and you have bleeding within the eye, and that bleeding can finally cause pull on the eye, on the retina, and cause the retina to detach also, so that's the later stage of the disease.
Network 18 Group has launched the Netra Suraksha India Against Diabetes initiative in association with Novartis India. With this initiative, one can simply get themselves connected with Netra Suraksha India Against Diabetes and get a self-check done by answering a simple questionnaire. The screener will help evaluate potential symptoms. Log on to www.news18.com/Netra Suraksha to know more.